I think the most important message with cervical cancer is that, and we can talk about this, is that it's not symptomatic. Like, you don't exhibit symptoms, you got to screen. It's like breast cancer, when you really, but even more so with cervical cancer, you want to be able to screen early on in order to detect this cancer, because it's asymptomatic often, meaning there usually are no signs or symptoms that a woman has cervical cancer early on. So until it's more advanced. Once it's more advanced, then we start to see some of those symptoms. But by the time you experience those symptoms, it is more advanced. It's going to involve slightly more invasive procedures. So some of those symptoms include intermenstrual bleeding, so bleeding in between your periods, finding that there's some bleeding after intercourse, and there may be some local pain, sometimes discharge. So, but once those symptoms actually develop, we know that this is more advanced typically. So really the objective is to screen early on. If you're a woman under the age of 30, then you should be screening starting at the age of 21, you should be screening every 3 years with a Pap test. So either you start at 21 or you start at the time that you become sexually active. So whatever, so if you are 21 years old, then you should start Pap screening. If you're 21 years old and you happen not to be sexually active, then you can wait until you become sexually active, and then you want to engage in routine Pap screening. Women above the age of 30, so between the age of 30 to 65, they should be screened every 3 to 5 years. And how often they're screened really depends on what type of screening test they engage in. So if you choose to do a Pap screen, you would have to do that every 3 years. If you choose to do a Pap as well as an HPV test, which now is the recommended way to go, then with those two tests, we call that co-testing, then you only have to screen every 5 years. So it would reduce the interval of needing to engage in the screening if you're doing the HPV test plus the standard Pap screen.